Okay, so for each quadrant, you are gonna need 2 inserts and 2 different techniques. As we discussed in class, if you have moderate calculus, or even if you have slight, you want to divide the tooth into 4 sections. We're gonna go first with our first technique, which is gonna be more like a curette-like technique. And that is going to be designed for interproximal and root trunk. So remember, we want to debride the entire root trunk. With this insert, your other rules still apply. In class from pre-clinic all the way to semester 5 now, you've talked about and learned that from the terminal shank that this bend, this carrot here, faces distal for all your curettes. Well, let's keep it easy and keep it simple that bend with the curette-like technique still occurs, and we know we have the right or the correct insert for the interproximal. So here, this is where we can remove and debride all the calculus, but our limitation is we can only go about 3 millimeters subgingival with this technique, but we can do all interproximals for this entire quadrant from the facial, because again, that bend is telling me that I have the correct technique and the correct insert to do all these interproximals. Now, opposite rules apply. Now with this buckle, I can go and be still correct for all the linguals using that same technique. Okay, we're here, and we're here. What we cannot do is go to our second technique, which is the probe-like technique for the facials. Do we see how that curve causes me to have the tip of the insert onto the tooth, and I'm using my face, which we know with all of our inserts, we only want to use the lateral and the back. But we can use this same insert for the linguals with that probe-like technique, in which now I'm using my laterals and my back to head into those furcations. I can go 4 millimeters down, which is what we want. This is a Perio insert. And we head all the way around the lingual surfaces. With this insert, I can now, if I've done the linguals with the probe-like technique, I can head to the facials or the buccal surface and do that same technique, rolling into those furcations, 4 millimeters down, debriding with the back and the lateral sides here. Now your question is, okay, well, how do I get the facials and how do I get the linguals? Well, that's where that second or that additional insert I need to change. So I switch out to my other insert. Okay, now I can do all the linguals here. My bend is heading distal, and I can use my curette-like instrumentation stroke for all these linguals, and then I can immediately switch to use my probe-like subgingival 4 millimeters down for all the facials, coming around as I wrap into and adapt into those furcations using the back and the lateral sides of my tip. Well, that's the video. You have 2 inserts, 2 techniques for every single quadrant in the mouth. Again, all your Perio degree 3, your Perio degree 4 patients, these are your inserts of choice. Good luck.